What is PTSD? A few months after I got out of the Marine Corps, I went to go pick up a friend at the airport in Los Angeles. Went from the parking garage to the terminal. Somewhere along the way, I lost my parking ticket. It's hardly exciting stuff. And as we approached the gate, my palms actually ended up getting a little bit sweaty. My heart started beating a little bit faster. I started getting a little bit nervous. Now, this was nothing compared to my time in the Marine Corps, to combat deployments, to my time training counterterrorism units in Africa. But as we approached the gate agent actually demanded that I pay a $200 lost parking ticket fee. And I'm embarrassed to admit this, but I flew into a rage. I actually got out of the car and started screaming at this guy. My friend put her hand on my shoulder. Zach, it's okay. Adrenaline and cortisol streamed through my veins. My amygdala had kicked into overdrive. My frontal cortex completely shut down. This was the classic fight or flight response. When you think about the symptoms of PTSD, hypervigilance, anxiety, restlessness, even the inability to sleep, these are symptoms that enable you to not only survive, but thrive when you're in danger. Whether it's a car accident, whether you have suffered a rape or sexual trauma, childhood abuse, or sustained combat, or even an isolated incident in combat, your body and your mind actually adapt in order to keep you safe in that environment. But what happens when you come home? What happens when you're no longer in danger? What happens when it's time to take off your combat boots and become a dad, become a mom, become a husband or wife, become maybe a teacher or a coach or a manager? About 6 years ago, I grabbed beers with my former battalion commander, a guy named Colonel Weill, and he looked really concerned. And that's not an expression I was used to Colonel Buell wearing. Colonel Buell led my battalion, 3rd Battalion, 1st Marines, during the biggest battle of the Iraq War, the Second Battle of Fallujah. During that battle, we lost 33 Marines. One of those Marines, a former sergeant, a few weeks before I sat down with Colonel Buell, came home, kissed his wife and kids at the dinner table, and killed himself, and walked upstairs and shot himself, killing himself with a gunshot wound to the head. Colonel Buell looked worried. We'd lost 33 Marines in combat, and about 500 men were wounded during that battle. Since then, we've lost 27 Marines to suicide. That means soon my battalion, one of the hardest hit battalions of the Iraq War, will have lost more Marines to suicide than we did to enemy action. A few days after I sat down with Colonel Buell, I went to go meet with some investors, 2 very successful finance guys in New York City, and I recounted for them the conversation I had had with Colonel Buell. One of them, a guy named Al Rabel, remarked to me, he didn't understand why he could see the top psychiatrist in New York City tomorrow morning. It didn't matter if that person accepted health insurance. It didn't matter what their rates were. It didn't even matter how busy that doctor was. They would make the time to see an Al Rabel. And Al asked a simple question. Why can't our veterans get the same type of care that an Al Rabel can get? So we decided to raise a small amount of money. We formed a partnership with Cornell Medical Center to start treating veterans in New York City. Now, one of the stipulations we had was that treatment had to be completely cost-free. We were going to pay for it. But it also had to be confidential. It also had to be bureaucracy-free, meaning that there was no paperwork, no wait times, and most importantly, it had to be effective. Now, at the time, I had no idea that mental health care was a real thing. I didn't even know that it worked. I thought of mental health care as something that Woody Allen would go into psychoanalysis for his entire life and have nothing to show for it. But I knew that we needed to do something. Shortly after we started this program, a young Marine, Afghanistan veteran, reached out to us. He wanted to know, nobody's going to know that I'm getting help here, right? It's completely confidential. He was suffering from panic attacks and anxiety. He couldn't sleep at night. It got so bad at one point, he thought he was having a heart attack and had to go to the ER. But those symptoms would go away with 1 beer, maybe 2 beers. Actually, it was 3 beers. And his girlfriend pointed out that that's called self-medicating. And so he knew he needed to get help. A light bulb went off. So he went to the VA. The VA issued him a bag of pills. He felt he'd been issued a death sentence because he grew up with Vietnam vets and he saw what they went through coming home from their war. But then he reached out to Headstrong. In his first meeting, through tears, he spoke to our medical director and said to describe his symptoms and also described his fears about his future. This is treatable, she said, 100%. You do the hard work and you can absolutely recover from these hidden wounds. Chris did do the hard work. And I'm proud to say soon he got better. He was sleeping through the night. Soon his anxiety and panic attacks and headaches went away. And even more importantly, soon his girlfriend became a fiancée. And then they got married. And then they became parents. A year ago, Chris sent us a letter. And he wrote, "I wanted to let you know that without Headstrong in my life, there's a good chance this would never have happened for Sarah and I. There were real doubts when I was going through my PTSD if I could raise a child in a healthy home. I always talked about Headstrong influencing generations of a family on such a positive level. I am now a perfect example of that. Chris has not only become a role model to me as a father, but he's also a personal hero of mine because he has the courage to tell his story over and over again to help other veterans overcome the stigma with getting help so that they have the courage to step forward and get the help that they need." Headstrong has now expanded to 18 cities outside of New York City. We have about 400 veterans in treatment, and we have plans to expand across the nation and to have 5,000 veterans in treatment by 2021. One of the things that I'm really proud of in terms of what we've done with Headstrong is we've designed a program that is essentially the Airbnb or the Uber of mental health care. What I mean by that is there's one model that we could have developed where we build really expensive brick and mortar clinics. We fund it with a high payroll, full-time staff. Instead, what we did is we tapped into the sharing economy. We tapped into the excess capacity of the private market in order to deliver this care. So when we go into a new city, we identify, recruit, interview, and vet the best psychiatrists, psychologists, and licensed clinical social workers in those cities. We then plug them into our network of care. We send them veterans to treat, and we pay for them to treat those veterans. One of the things that we demand, though, is that they submit their notes to our team at Cornell, and that they also participate in monthly case conferences, and that way we have accountability of outcomes, and we know that the veterans we're paying to get treated are actually getting better. Now, this sounds somewhat complicated, and it might sound really expensive, but in actual practice, this is incredibly efficient and incredibly cost-effective. When a veteran reaches out to us, we're in touch with them usually within less than 24 hours. We get on the phone with them and we try and identify what drove them to get help. Is it they can't sleep? Is it a problem with their wife? Is it substance abuse? Is it some combination? Because we're a goal-oriented treatment program, we want to focus on helping them achieve those goals and overcoming those issues that they're dealing with. They then meet with a psychiatrist, MD, in their community. They get an initial diagnosis, make sure they're a good fit for outpatient care, and then we plug them into an individually tailored treatment program. That treatment program could involve substance abuse treatment, group therapy, couples counseling, EMDR, cognitive behavioral therapy, psychotherapy, interpersonal therapy, whatever they need in order to get better. And what we found is that this system really, really works. But one of the things that I'm also really proud of about Headstrong is that not only have we shown that if you get the help that you need as a veteran, you can recover from the hidden wounds of war, but that no matter what the trauma is that you're dealing with through post-traumatic stress disorder, this is treatable and you can get better. Thank you.